We have new insight into the Ebola epidemic that rocked West Africa last year and spread fear around the world. Thankfully, the deadly virus was contained, but not before claiming thousands of lives. And now a new investigation shows the World Health Organization may have been more part of the problem than the solution. CBN's George Thomas reports.
It was last summer during the height of the Ebola virus. In Sierra Leone's third largest city, a frantic race was on to stop the deadly disease from spreading. But for those on the front line facing down the killer virus, it was a struggle from the get-go. Joseph Fair is a disease expert and was advising the Sierra Leone government during the Ebola crisis.
There were particular incidences during the outbreak when we had an extreme shortage of, say, body bags or personal protective equipment. We had a number of bodies lying outside in the rain with no body bags.
And this was apparently just the tip of the iceberg. An Associated Press investigation found that the United Nations World Health Organization and other first responders were completely unprepared or organized to deal with the unfolding health catastrophe. Batches of chlorine desperately needed to fight off the virus were past their expiration date. One consultant with the WHO wrote to his bosses saying, quote, "I was deeply shocked. The consequences of using it could be catastrophic and cause immediate infection of all the staff, contaminating them and us with the virus." Health workers also lacked basic protective gear and had a difficult time getting essential medical supplies to care for the sick. Newly obtained emails show WHO and other responders failed to organize a strong response even after the health alert was issued.
Well, there's no question in my mind that the slowness of the response, the delay in the response, the disorganization of the response on the part of the World Health Organization had some very dire consequences in terms of lots of lives lost that shouldn't have been.
As a result, Sierra Leone lost more health workers than any other country affected by the virus. While the epidemic has waned in Liberia, cases continue to pop up in Sierra Leone and Guinea. Clinical studies are underway to test a potential Ebola vaccine that could help contain the disease.
One of the vaccine trials had shown very positive results, and so now they're using it when someone gets sick with Ebola. They're vaccinating their contacts, the people around them, the people in their village, and that's really helping, I think, to reduce the spread.
George Thomas, CBN News.